You may have noticed over the summer and in October that Gloria Chapa was not here for a few weeks, but she wasn't on vacation. Gloria was dealing with an all too difficult problem, a breast cancer diagnosis. Now, Gloria is back from surgery. We're so glad to have her back right here at Files on the Morning Edition. And now she's decided to share what she went through, her journey. And Gloria, what was it like when you first heard those words that you have breast cancer?
Well, it shocked me because I had no idea. I mean, it takes you completely flat-footed. So basically, the worst part was my diagnosis went from being able to have a lumpectomy to mastectomy, which of course just devastates you. So it started an entire journey of making decisions about my life, the rest, my health, and I decided to share that with you.
On August 31st, I underwent breast cancer surgery at Weill Cornell Medical Center. Well, here I am in my finest hospital fashion. Not looking forward to it, but I think I'm about as ready as I can be. That day came 4 months after my diagnosis of ductal carcinoma in situ, or DCIS. That's one of the earliest forms of breast cancer. Still, it wasn't that simple.
Now, what's confusing for patients sometimes, which was the case in your situation, is you may have stage 0 breast cancer but have a lot of it in the breast. And so because of that, one might really need to have a mastectomy. Even though you have a very early breast cancer, you have a lot of volume of disease.
After researching a number of hospitals, I decided I felt most comfortable with Drs. Rasha Simmons and Tessa Siegler. They convinced me a bilateral mastectomy was my best option.
There's a higher chance that you might have a recurrence of the DCIS or the invasive breast cancer in the same breast. You're going to do a mastectomy, so it takes away that worry. But having DCIS in one breast means that in general you're someone who's at increased risk of developing a new breast cancer in the other breast.
Making sure I was healthy was my top priority. But as a woman, making sure I was happy with how I looked after surgery was almost as important. So finding a great plastic surgeon was key.
At our team, we have the people who are concerned about the number of years that you're going to live. We also have the people like me who are focused on the quality of the life that you're going to lead. So I have my phrase that says, as the plastic reconstructive surgeon, I don't add years to your life, but I add life to your years. Since you're having both sides done, the best way to get symmetry is for me to do the same reconstructive operation on both sides.
After my diagnosis, I kept the news to myself while I processed the emotional and practical problems ahead. Like most of us, I knew many people affected by breast cancer. I let a few close friends know, including my friend Mark, who lost his mother to breast cancer.
It's been, I think, it's almost 15 years since my mom passed, and so much has changed, and the prognosis is so much better now.
He assured me that I was not alone in my fight.
Some of my friends, got really scared and, backed off, and I didn't hear from them very much, because it is a scary word. And you were like, nope, you're fine, don't worry, you're a strong woman. Technology and medical advances are great now, and that was very heartening because it was nice to hear that from someone.
Well, glad I could help. You're among a great group of women.
Exactly.
That's a weird way to look at it, but it's true.
And Gloria, talking about the surgery, exactly what kind of surgery did you have?
Well, I had a bilateral skin and nipple sparing mastectomy with immediate reconstruction, which, by the way, does not mean that you walk out with breasts immediately after you get out of surgery. What happens is they start the reconstruction immediately, but it made the biggest difference in my decision about this whole treatment because they're one of the only hospitals that do the nipple and skin sparing mastectomies. And as a matter of fact, Dr. Simmons actually pioneered the surgery. And so for a few years, it was the only place that you could go. So at Weill Cornell, being offered that decision, it changed my decision entirely about having one or both sides.
So what's next for you as you continue recovering?
Well, I do still have a few tweaks here and there. I know it sounds funny, but I still see my plastic surgeon, and so I have to go in and they see how I settle in, and they, he goes in and, does whatever little fixes he has to do to make sure that I look good for the rest of my life.
And how are you feeling day to day?
I'm feeling very well. I don't have any restrictions at this point. My last surgery was October 17th, and that was when they put in the permanent implants, and I can run, I can exercise, I can do my push-ups. I'm excited.
Well, Gloria, we are So happy you're healthy, you're back here at work, and you know, she does a great job reporting the traffic every day and doing entertainment, but she's just a great person to be around, and we have a lot of fun together here on the set and in the newsroom. And Gloria, thank you so much for sharing your story with all of our viewers.